The Abbott government wants to slug families, pensioners and patients a $7 GP tax every time they visit the doctor, get a blood test or get an X-ray.
This government's appalling proposal to bring in co-payments for Medicare, effectively dismantling our universal health care system that has served our country so well.
Ill-considered and unfair GP tax that'll do exactly what it's designed to do, and that stop patients going to see their doctor.
Tony Abbott and the Coalition do not understand, or they simply do not care, that this tax will hit the most vulnerable in our communities, and it'll hit them hard. The sick, the poor and the elderly will be the ones to pay for Abbott's broken promises.
The Abbott government's plan to undermine universal health care with Medicare and PBS co-payments will affect every Australian. But there is no doubt that this attack on universal health care will have the biggest impact on those who can least afford it.
The whole point of imposing the GP tax is to reduce people's propensity to go to the doctor. In other words, it's to discourage people from going to the GP. Now, in our side of this house, we believe that people should be encouraged, not discouraged, to go to the GP.
Loden Murray, Medicare Local's new medical advisor, has come out saying that the proposed GP tax, the $7, will actually hinder patients from seeking the help and accessing the care that they need.
At $7 per visit, that leads to an increase in my electorate alone in cost for GP services of $6,497,575.
In regional areas such as Kilmore and Broadford and Seymour, where we have higher elderly populations, it is especially going to hurt.
The GP tax is the most insidious part of this budget, Deputy Speaker, and the thing that goes to the core of this government's callous disregard for the welfare of everyday Australians.
This appears to be but the first step in the Liberal Party's plan to dismantle Medicare and universal health care in Australia. Let it be known that we on this side of the House will continue to fight the government against their attacks on universal health care in this country.
They weren't up front at the election. They refused to acknowledge that they were actually seriously looking at this back in February when the Commission of Audit was looking at it, and then leaked that it was going to be $6 and it ended up being $7, and we all know this is a path to a $15 GP tax as flagged by the Commission of Audit.
It is unfair and unacceptable to tax the sick people of Australia in this way. It is unfair to tax those who are suffering from chronic health conditions. It is unfair to do this to the older people in Australia who are more often likely to access GP services.
Well, I can tell you that the opposition will be talking about this all day, every day, until election day.
Why won't the government listen to the people who know best about the impact of a $7 doctor's co-payment on families and drop this mean tax on families around Australia?